Good afternoon, respected dignitaries on the dais. I, Dr. Purva Srivastav, co-author of this study, will be presenting this study, Incidence of Ocular Ailments in Slums and Rural Areas, on behalf of Dr. Khurram. We have no financial interest, disclosures, or conflict of interest. So this study was aimed to evaluate the prevalence of different ocular ailments in the slum-dwelling and rural population of central India and to find its correlation with various socio-demographic factors. So it was conducted as a cross-sectional study in the 84 slum areas across Bhopal. So some areas in vicinity were also covered. The approach was camp-based, and the study period was about 3 years from 1st June 2017 to May 2021. So study was conducted in different capacities by all the 4 authors participating under different government and non-government banners. And a total of approx 15,000 participants attended these camps, and out of them around 6248 patients were found being afflicted with different ocular ailments. So detailed data was obtained from the participants of the camps, and it was tabulated later so as to study the correlations. So we recorded the age, gender, socioeconomic status, also the diagnosis that we made and how we dealt with it later. The data was compiled and processed. So we had approx 15,000 patients who were screened for the ocular morbidities using a camp-based approach, and approx 6,248 patients had some affliction or the other. So majority of the patients belonged to 31 to 50 years of age, and maximum patients having some ocular ailment belonged to more than 30 years of age. The morbidities were significantly higher in males. So the most common disorder that we saw was refractive errors across all age groups, followed by allergic conjunctivitis, lid pathologies, pterygiums, and cataracts. So this I have already dealt with. And the least common morbidity that we found was ocular malignancies. Upon diagnosis, we had the option to treat. Since it was a camp-based approach, so we did have the option to give them the refraction services. But apart from that, we had them referred to our base hospitals in Bhopal, so where we could operate upon them. So a lot of pterygium and cataract surgeries were done, and some DCRs and glaucoma surgeries were also done. This I've already dealt with, that the major surgical surgeries were done for pterygium. So when we were comparing this with the other similar community studies that have been done previously in the rural or the slum dwelling population, so in other studies also similar statistics of the affliction was found. However, we did have a little bit of contrast with other studies with because of the geographic area that they covered. So basically, concluding idea is that stress should be on the camp-based approach, so we can go on conducting camps, screenings, providing them with the whatever treatment we have at our hands, whatever resources we have, and then referring them to the base hospitals so that these diseases do not get undiagnosed, they don't get untreated, and so that ultimately we can reduce the burden of blindness in the low socioeconomic and rural slum dwelling population. However, we did have our limitations because this was a camp-based study. Thank you.